Check, check. All right. Hello. We're going to get this going here shortly. All right. So we're going to get this going shortly. Give me just 1 second. We're going to let everyone hop on. We'll give it a minute here, and then we'll let everyone give everyone just a couple minutes. Oh, come on. All right. We should be good to go here now. So 7:01, we're going to get going. So thanks everyone for joining. Hopefully you guys can hear me okay. Just 1 second. You have 5 seconds. All right. If you can give me a thumbs up that you can hear me. Sorry, if you hear anything in the background, I'm going to try and mute as much noise if we can. I've got everyone here muted, so we'll do questions at the end if you guys have any specific questions for me. But yeah, we're going to get this thing rolling. So thanks everyone for joining for the virtual low back pain workshop. My name is Dr. Eric Broadworth. I am a physical therapist. I got my little bit of a background on me. I got my doctorate of physical therapy from Grand Valley State University in 2014. Is when I graduated. I then went and worked at Advanced Physical Therapy right after school. Also became a certified strength and conditioning specialist. So I worked over at Advanced for about 1.5 years, worked with a lot of high-level an elite gymnast. And then from there, I went and moved to West Michigan and got a job at Physiotherapy Associates, now known as NovaCare Rehabilitation. And I worked there for about, let's see, it was 2016 to 2020. So I was the center manager at the Allendale Clinic. We had a contract with Grand Valley State University. They still do have that contract. And so I saw a lot of pretty high level athletes there, D2 athletes, as well as general population and high school athletes and all that fun stuff. Currently, I run my own business. I started Fuel Physical Therapy and Sports Performance on the side in 2018, I believe, and then just went full time with that. And I treat mostly right now CrossFitters and runners. I treat a lot of other athletes as well. So right now I'm seeing baseball players, lacrosse, all that fun stuff. But so that's kind of a little bit about me. I see a lot of back pain. So one of the main reasons I do this workshop is there is a lot of myths and just things that are not true about back pain and how to treat it. And so I hope that you can get from this something useful. So hopefully you can at least take one thing away from this, something that's useful to help you with your own back pain. Back pain is the leading cause of disability in the United States. It is a billion-dollar industry, and it can be very confusing and very frustrating. And that is why you see all sorts of things out there. And if you ask one person how to treat back pain, you're going to get a completely different answer than another person. That's why there's, physical therapists, you have chiropractors, you have massage therapy, you've got all sorts of different gimmicks and things you can put on your back, and the list goes on and on. And so there's a lot that we don't know, but there are things that we do know. And so I'm going to use facts and evidence-based information in the presentation here today. So that way, hopefully you can take something useful from this and use it to help make positive changes. So the objectives of the workshop: we're going to learn about the possible causes of low back pain and the difference between acute and chronic low back pain. We're going to learn about the kinetic chain and how movement at one joint can affect movement at another joint. We're going to identify the difference between a dynamic warm-up and static stretching, and learn how to utilize a dynamic warm-up properly prior to exercise. We're going to learn drills to improve mobility at the trunk, hips, and ankle. And we're also going to learn drills to improve core stability. And those are going to be the main things that we're going to focus on. And then afterwards, we're going to do a live question and answer and see what questions you guys have, if any. So we're going to go on first to the causes of low back pain. So there can be a number of causes of low back pain. Obviously, trauma. So if you're in something like a car accident, that can cause back pain, right? If you were to fracture a vertebrae or do some sort of damage, that can definitely cause some pain. And that pain then right there, right immediately after an accident, that would be acute pain. So acute pain is within 3 months, 0 to 3 month range. Chronic pain is 6 months and after, typically. So once you get to that 6 month range, then you're getting into a more chronic pain. And so it's important to know the difference between the two. If you were in a big accident, 1 second here, we're gonna mute. All right. So if you were in a pretty significant accident, x-rays can definitely be important. And so, however, a lot of people, when they come to me and they've got just a gradual onset of pain, or there wasn't any very significant trauma, or the pain's after 6 months, they've already had x-rays or something like that, a lot of times you really don't need any more imaging. So, because a lot of people will come to me and will say, you know, hey, Eric, I've been having this back pain for a month, a couple months, however long. Should I get an X-ray? Should I get a CT scan or an MRI? I really think I need an MRI. And my answer is typically no, right, for initially, okay? And the reason I typically tell people imaging isn't necessary is because I call it the most expensive selfie that you'll ever take. So an MRI typically costs about $1,500. And all that is it's a still picture in time, okay? So you lay on the table and they run you through the machine, and all it shows is how you lay on that table. It's not going to show how you move. It's also not going to show how your back was before the MRI or X-ray. So a lot of times things can come out that are pretty scary from that X-ray or MRI. Things you'll hear such as degenerative disc disease, arthritis, bulging discs, all of those things. However, and while those can be scary that those show up on an MRI, what they found is through a bunch of different studies is that there is no correlation between imaging and pain. So they've actually done studies where they've taken people off the street, okay, who are asymptomatic, they don't have any pain, and they've done imaging on them. And what they found is all those things: arthritis, degenerative disc disease, bulging discs, yet these people don't have pain. And then you yourself, you do have pain. So why is that? They found that there's no correlation between that. And so what I typically tell people is, let's go through conservative treatment first. Let's rule out any red flags. Let's rule out anything that, if this could be something more sinister that isn't appropriate for physical therapy, okay? If you're not appropriate for physical therapy, I'm gonna send you on and definitely have some imaging done, or have likely an MD take a look at you, okay? However, if you haven't tried therapy before and you don't have any red flags, let's try the conservative treatment approach first. Let's really analyze how you move, and let's analyze things from a number of different angles. So that brings me into my next topic as far as causes of low back pain. Causes of low back pain, things that can, especially when the low back pain is chronic, stress can play a factor, your emotions, your mental state. A lot of times my people that have chronic pain, I'll ask them, when they're more flared up, is life stressful right now? And yeah, a lot of times usually life is pretty stressful, whether it's the kids or work or something like that. And so then we can, if we tackle the stress part of things, a lot of times that pain will come right down, okay? And it'll be more tolerable. So that's kind of my 2 cents right there on imaging and on the multiple factors, the psychosocial factors that can cause back pain. All right. Some other causes can be overuse. So if you've got a dental hygienist, for example, I see a lot of dental hygienists where they're in one position all the time, all day, and then their back starts to hurt because they're not going into any other position except for one position. Now, if I were to hang out like this all day, I can tell you my back will get flared up. So an education point is very important for those people, and for all people dealing with back pain. Education is huge. When it comes to weightlifting and athletics, a lot of times poor technique is the contributing factor, and some other things that can play a big role, not only poor technique, but what's going on throughout your kinetic chain. So how's your ankle mobility? If your ankle mobility is poor, okay, if I'm going to do a squat and I can't bend my ankles the way that they should during the squat, okay, then I'm going to come forward here like this, and that's going to place some strain likely on my knees, hips, or low back. If my knees are collapsing in and my hips don't have the stability, same kind of thing. I might get some knee pain some back pain because my hips don't have the stability there. So really analyzing and fixing poor motor patterns and fixing technique can go a long ways in helping with back pain. And we're going to go over, so that's why we're going to go over a number of different drills. So just as a little bit of a disclaimer, this is very generalized, right? So that's why we'll do some specific question and answer. If you're having any red flags, any like bowel or bladder issues, numbness, tingling, anything like that, you really need to go seek medical attention and go seek your doctor's advice. This is, very general information and is not designed specifically for your case. So just a little bit of a disclaimer there. All right, so let's get into a dynamic warm-up versus static stretching. So for those of you who are exercising, okay, we're gonna get into what's the difference between a dynamic warm-up and static stretching, which is better. So with a dynamic warm-up, we're moving through motion. So for example, for a dynamic warm-up, if I'm about to go do weighted squats, I might do some body weight squats to warm up. You're moving through the motion. Okay, I might do some hamstring stretches like this. All right. You're moving and you're doing maybe a brief pause and really stretching through the movement. Static stretching, okay, a classic example would be when you're a kid and you're in athletics and you do that forward bend and you hold for 20 to 30 seconds, that's static stretching. So what they found in terms of performances with exercise and with athletics is that dynamic warm-ups are better before, okay? You want to get the body moving. Static stretching can actually negatively impact performance before. It's okay afterwards if you want to do some static stretching afterwards and get into a deep stretch, but beforehand, it's not typically recommended and can have effect on performance. And let me mute. So typically recommending a dynamic warm-up that is using movements that are specific to the exercises that you're about to do. All right, so next we're gonna go into some mobility drills for the trunk. Now, we're getting into the more active part. I'm gonna recommend that everyone do these along with me. I know it might seem silly. If you want, you can shut your camera off. You don't have to have the camera on if you're worried about people seeing you, but let's go through these movements together. So I'm gonna do them, and I've got my table here so you can see me. So the first movement that we're gonna do to get that spine moving and mobilizing good, okay, is if you can see me, we're gonna do a cat-cow. So if you're familiar with yoga, okay, this is a really good one to get the whole spine moving. So I've got my hands and wrists directly under my shoulder, all right? I don't want them way out here. I want them right under my shoulder. I've got my knees directly under my hips. And what you're gonna do, you're gonna extend the spine and look up, all right? And then we're gonna flex the spine. So you're flexing, you're rounding the back, really pushing through your hands. Tuck your tailbone. And you're gonna hold each one for about 5 seconds. So we're gonna do 10 reps of this total, okay? So it's 1, 2, 3, 4, 5, and then we're getting in the next one. Now, if this hurts, okay, if this is painful and it's getting worse, then maybe this isn't the exercise for you. And that's how all these exercises are gonna go. If it's painful, this one might not be specific for you and you might need a different variation. So we're gonna just do this 10 times total. And if you can't get on your hands and knees, if you've had a knee replacement or something like that, then don't force yourself onto your hands and knees. There's some other drills that you can do. So just a 5-second count. And really try to work into that end range. All right. So the next drill we're going to do is simply to work on a little bit of mobility. If your back's really stiff, say you wake up in the morning and it's like, holy cow, one thing that you can do is simply lay here, have your elbows under your shoulders, and you're just going to prop up onto your elbows. So what we're working here is we're working into extension. All right. And you can hold this for 2 to 3 minutes at a time, and then you can lay back down. Now, some people's backs really like extension. So you might notice with an exercise like this, if your symptoms centralize or go towards the center of the low back, initially it might be a little more painful, but as you do it, that gets a little easier. Your symptoms with this should not go from the back into the butt and down the leg. If you already have symptoms into your butt or down your leg, it should come towards the middle of the back. That's called centralization. That's what we want to see. We don't want to see with this peripheralization where the symptoms go from the back down the leg. Okay, it should not make any numbness and tingling worse. So again, you can hang out here for 2 to 3 minutes, and then you just relax, and you do a couple sets of that. Now from there, once your back's kind of warmed up there, so if you're really stiff in the morning, that might be a good one for you. And then what you can do is you put your hands under your shoulders like so, and you're gonna push your chest up, and you might only get so far, but the key is to get to end range here. And the same rules of that centralization and peripheralization apply. So don't want symptoms going down the leg. It might feel pretty stiff initially in the low back, but then it should get better as you go. So about a 3 to 5 second hold, and you're gonna do 10 of those. So I hope you're moving along with these. You should be moving right along. All right. So next, what we're gonna do, just 1 second here. Next, what we're gonna do is what I call book opening, okay? So we're gonna move this out. So you're gonna lay on your side after you've done 10 of those, and you're gonna have your hands out in front of you like so. I've got my knees stacked together. Now I don't want my pelvis moving, so I wanna keep my knees stacked together the whole time. And you're gonna take this arm, you're gonna reach all the way back. I've kind of got a little bit of a wall in the way. And you're going to, I want you to look with your face towards your hand. Once you get all the way back as far as you can, you're going to breathe all the way out and try and lower a little further when you breathe out. And you're going to hold that for about 3 seconds, 3 to 5 seconds. And then you're going to come back. And we're going to do that 10 times. There's 2, 3, 4, 5, 6, 7, 8, 9, 10. And then once you do that, then we're going to switch sides. So we're going to do the other side as well. Now, again, shouldn't necessarily make your pain worse. If it does, you might need to modify it. Just like so. And it's normal for this to feel tight at first. but you should find more range of motion as you go. Good. And I'm just doing a 3-second hold for time's sake. You can do a 5 if you want. All right, so with that drill too, sometimes what I'll do to keep people's pelvises level, if you find that your pelvis is wanting to shift and roll back, you can place a pillow and squeeze a pillow between your knees, or you could use like I'll use a foam roller sometimes if I've got that around, I'll lay that on the ground and have their top knee, okay, the knee that's on top, stay on that foam roller the whole time. All right, so those are some pretty good mobility drills that you can do for your back. Now we're going to work on some mobility drills for the hips. So a lot of times what I find, especially whether it's people, just general population, everyday back pain, or even with athletes, either way, a lot of times there's some limited hip mobility that can be contributing. So we're going to go over some hip mobility. Now, let me explain this to you a little bit. So if you're going into a squat, right, and if you're lacking the hip flexion, but you need to get down to reach something, if you're lacking that, right, where's that movement got to come from? Well, it's got to come from somewhere else, whether it's your knees or your back, so that can place some increased stress on that back. You also need, if you're going to be getting into any like deep squatting positions, you need your femurs to internally rotate. There's a rotational component. And if you're lacking, if you've got some pretty stiff hips there, that's again going to cause you to have more mobility elsewhere and strain some other parts of the body. Oftentimes that can be, again, knees or back. So we're going to go over some mobility drills. Like I said, one of my favorite ones, it's called windshield. I call them windshield wipers. So we're going to sit up just like this. All right. My feet are about hip width apart or shoulder width apart. I'm going to put my hands behind me and sit up nice and tall. And I'm going to drop my knees down to the side here. We're going to hold for 5 seconds. And then we're going to go to the other side. Now, what you want to do when you do this, you want to try and keep this hip, you want to keep your butt on the ground, okay? So you're going to find that that's probably pretty stiff. And again, we're just going to do 10 reps of this. You'll probably find that this is pretty stiff, but as you go, it should get a little better. All right? And then, once those hips loosen up, a way to progress this and add a little bit of some core stability and work those hips even more, if you bring your hands up to chest height, okay, and then you're trying to do it, just like so, that's a little harder. Now, pay attention too. You might find that one side is stiffer than the other, all right? So you'll want to focus on those sides that are pretty stiff to try and get them a little more equal. So that's about 10. The next one that we're going to do for the hips here, we're going to do some knees to chest. All right, so you can do this either in standing or laying on your back. So if you just bring that knee to your chest, just like so, and this can feel pretty good, especially if you're doing it laying down. A lot of times it can provide even a little bit of traction sometimes for your back, some slight flexion. It shouldn't make your back worse, okay? But typically holding that for about 5 to 10 seconds. And you could do, if you want to alternate, you could alternate, or you could do all one side and then all the other side. So we'll go through this real quick. About 10 reps each side. Good, so that was 10 on one side. Now I'm gonna finish up the other side. And notice how I'm adding some overpressure, okay, with my hands here. All right. So next, so those are some mobility drills for your hips, okay? That can be really good to get those hips moving and improve that mobility and that range of motion there. Next, we're gonna go into some mobility drills for the ankles. So like I said before with those ankles, especially what I find with people is they don't have enough dorsiflexion. Dorsiflexion is if I take my ankle here, okay, if you see me, and I pull my toes and my ankle towards me, towards my head, this angle right here, that's dorsiflexion. Now this is plantar flexion if I point down. A lot of people don't have enough dorsiflexion. This mobility and maybe some of the flexibility in their calf, it's pretty tight often. So that can be one of the causes, okay, of their issues, of their back. And so it might be something that we want to focus on. So what we're going to do, what I want you to do first, if you have a wall, I'm going to move my table here. So if you have a wall by you, what you can do is if you take your thumb, all right, and your fist, and you put your fist at the end of your foot and your thumb to the wall. So say I got the wall here, and then I should be able to see how far can I bring my knee to the wall. Okay, this is the distance, it's about 4 inches. And then can I keep my heel down and touch my knee to the wall? Also, can I do that without letting my ankle and my foot collapse in? So I don't want my knee to dip way in to try and get that range of motion. So go ahead and give that a try right now and see where your ankle mobility is. And you might notice that one side is definitely stiffer than the other. All right. So once you're done with that, then we're going to go into the first drill. So I'm going to get up onto here. I've got I'm in a 90-90 position like this, okay? My heel's flat. I'm going to use some pressure from my hands to bring my knee over my foot. Now, if you have a weight such as a dumbbell or a kettlebell or something like that, you can use that to help with this. And you're going to hold for about 3 to 5 seconds and then back and doing 10 reps of that. The key is to keep that heel down onto the table. So if you need to use your other hand there, you can. But we're going to do about 10. And then you'll switch sides and do 10 the other side. So I did about 5, and then now I'm going to switch to the other side. All right, we're just going to keep this moving. So just like so. And again, try to make sure your foot's not collapsing in. You could even wiggle your knee at the end a little bit there. You can go in and out to play with that range of motion. Just making sure you've got that heel down. Just like that. And you should notice you're able to get a little further and a little further. Now, a good way too, now, if real quick, I want you to, after you're done with that, retest your ankle mobility and see if it improved. A lot of times, I'll find that people can improve their ankle mobility pretty quick right there. And a lot of times, when it's that quick of a change, we're having a little bit of influence on the nervous system is really what we're doing. So go ahead and retest that when you get a chance. And then we're gonna change the angle here for the next one. So another good ankle drill here would be a down dog. So if you are familiar with yoga, all right, we're going to go into a down dog. So if you can see me, you're kind of in a high plank position, and then you're gonna bring your hips up, and you can then drive your heels down, and then you can kind of pedal your feet, and you'll feel a pretty good stretch in the back of the calf with this, and even into the hamstrings. Now, here's a little bit of a disclaimer. If your back pain does not like forward bending, if flexion really flares you up, this is not a good exercise for you, okay? So if your back really gets flared up with staying bent forward, this might not be a good exercise for you. So again, with any of these exercises, don't force it. You might have to modify them. And there's definitely different ways to do that and customize them to your needs. So we'll do about 10 each side. All right. So next is some of the stability drills, okay? So we're gonna go over some drills for some stabilization. So a lot of times with people with back pain, you can fall into a number of different categories. So some people, they've got too much mobility, they're too flexible. If you find that flexibility really isn't an issue for you, yet your back's killing you, honestly, it's likely a core stability issue, okay? And so some of these drills might be for you. So these are some of my top stability drills for people. So the first one, we're gonna go on our hands and knees again, like so. And we're gonna do a bird dog. So the key with this is make sure you have a nice neutral spine. I'm gonna raise my opposite arm and opposite leg. So it'll be right arm, left leg, and then left arm, right leg. And we're gonna alternate. So you're going to lift up both at the same time. There should be a straight line from your hand to your foot. I don't wanna see you arching way like that, just a straight line. Really feel those glutes engaged and the shoulder, and then you'll switch. I also don't wanna see you rotating. So again, nice neutral spine with this. And then we're just alternating. So about 10 of these. And with this drill, a good way to see if you rotate too much or if you're moving too much through your back, take a tennis ball and put a tennis ball right on your back. Or if you have like a foam roller, a short foam roller, you can put a foam roller on your back and you have to balance it while you do this drill. It's pretty tough for a lot of people. Another key point is don't arch your neck way up, okay? You want to look right down at the table and make sure your neck isn't getting strained either. All right. So then the next drill for some stabilization is what I call a fire hydrant. So if our hands again are right under our shoulders, knees under our hips, you're gonna lift the one leg up And what I don't want to see you do is rotate through your back like that. I'm over exaggerating, but you want to keep everything level. So it doesn't have to go very high. And we can do 10 each side there. So I'm doing my other side right now, so make sure you're doing both sides. Now, the last stability drill for you to do, I really only do this if my patients are really flared up. So if you're really flared up and having a tough time moving and you can't hardly bend at all, you could lay on your back, just like so. My knees are bent. And this is called a pelvic tilt. So you're just simply going to flatten your back down into the table, breathe out, feel your ribs sink and become flat. You'll hold that for 5 seconds, 5 to 10 seconds, and then relax. So you'll feel it's just a very small motion here, and then relax. This is it should be a pretty simple drill. So if this is not simple for you, it might be something to work on. Usually I only do this with my patients who are really flared up and they need just a slight motion to get something calmed down. Okay. All right. So we're going to go over the question and answer in just a second, but let's review what we've discussed. We looked at right there with a lot of those drills, all of the kinetic chain and how the kinetic chain can influence some stress and strain on the back. We identified that a lot of times you don't need imaging for back pain. Okay, you don't necessarily need imaging, and that psychosocial factors, not saying that's all in your head, but stress can play a very big role. Prior trauma, all of these things can play a factor, okay? Especially with chronic pain. We discussed drills involving hip mobility, mobility of the spine, ankle mobility, some trunk mobility, and then we went over a couple stabilization drills right there. All right. So that's essentially what we discussed that can help a lot of people with back pain. Now, again, this is very generalized and this isn't necessarily specific to your needs. So one thing that Fuel Physical Therapy in my business, so my business, Fuel Physical Therapy and Sports Performance, can do to help you out right now is I do only one-on-one visits, and I also do telehealth. So right now with the coronavirus and everything like that going around, it's important to do the whole social distancing and keeping space. This is a really great way to do that. It's also very cost effective and it's very convenient. So I've been doing telehealth now for probably about 9 months with people. It can be very, very effective. Sometimes all people need is to be guided through some specific drills to their needs. So with the telehealth, we can examine exactly how you're moving and find the root cause of your symptoms based on how you're moving, what you're feeling, and the feedback that you give me. From there, we can develop a specific plan of care to your needs that will meet your specific needs. So that way you can decrease your pain and get back to doing the things that you love. Just because that we're, in a quarantine doesn't mean that you shouldn't be able to work out and exercise, play with the kids, go for a run. Today in Michigan, in Grand Rapids, where I'm at, it was 56 degrees. Beautiful day to go for a run. And back pain should not be limiting you from being able to do that, okay? I've dealt with back pain myself. I can tell you it is not a fun experience at all. And I can really relate to those who are going through it. And essentially, I was able, this most recent episode, I'll tell you a little bit of a story. I really irritated and tweaked my back doing a workout on January 2nd. And I knew immediately, okay, here's what I need to do. I took it easy for about 48 to 72 hours, those 2 to 3 days. After that, you want to get active, okay? Rest isn't always the best thing for back pain. So after that first initial period, if you initially hurt your back, you want to get back into your everyday activity and routine as much as you can. Exercise has been proven to be one of the best things that you can do to prevent back pain. So that was one of the things too that I'd hit on is how can we prevent back pain? And that's through exercise and specific drills for your needs, okay? But exercise, that is one of the best things you can do, as well as proper nutrition, making sure that's intact. Those are all very important. A lot of people think that weightlifting is bad for your back, things such as deadlifts and squats. That's not true. Now, everyone's body is a little bit different and everyone squats differently. That is true, and you can take those considerations into consideration when you're developing your own plan, okay, and when you're exercising. But one of the best things that you can do for your back is exercise and is weightlifting and is endurance training, okay? So backing up the bus, I've done the virtual visits. The telehealth is what it's also known as, okay? Virtual visits or telehealth. It's simple, just through Zoom, just like this. Normally for evaluation and treatment, what I do, it's 30 to 60-minute sessions. Okay, we identify your root cause, and then we come up with a specific plan of care for you based on how you're moving and find specific movements that help to relieve your pain. We then do any question and answer any questions that you have. Your home program, again, is customized to you. And then with all my patients, they get my number and they can text me at any time, all right? And then if they absolutely need hands-on care, because some people do, not everyone needs hands-on care, but some people do need hands-on care, we can determine who you should go see if you do absolutely need hands-on care. Now, with all of that, what that typically comes to for people is about $350. My normal virtual visit rate is $149. If you decide that this is something that you need, if you have a flare-up, it's only going to cost you $129, but you have to book here tonight. So my schedule is booked up. It books up very, very quickly. So I'm only offering that $129 special. That's only valid for tonight, and that's a thank you for coming on here for this telehealth or this virtual workshop here today. So I hope you found some of this beneficial. And again, we're going to go into the live Q&A in just a second, but that $129 special is only good. Now, I know with a lot of people, that's probably more than you'd expect to spend maybe on healthcare. Healthcare I know isn't cheap. As an added bonus, I have a money back guarantee. So if you find no relief or are not satisfied, or we can't find what's going on with your back, if you were to book one of these telehealth visits, the virtual visits, 100% money back guarantee, because I believe that the focus should be on you getting better and not on the cost of care. I want you to get back to living the life that you love to do, whether it's weightlifting, running, playing with your kids, okay? You shouldn't be limited because of back pain. So, yeah, that's that. We're gonna open this up to some question and answers. So I'm gonna just unmute everyone. So if you have any questions, you can, if you don't mind turning your camera on so I can see who who's on and whatnot. Maria, I'm trying to unmute you. Oh. So if you have any questions, now is definitely the time. Any questions?
It's always
And if you don't feel like asking any questions, then you can always message me your questions too. If you want them private, you can definitely those as well. Cool. All right. Well, if no one has any questions, we'll end this here. And then thanks so much. I really appreciate everyone jumping on. I'll be uploading this as well to YouTube and Facebook. So if you need to revisit it, it'll be on there. So thanks a lot, everyone, for jumping on. I really appreciate it. Have a good rest of your night, and hopefully stay safe and healthy during this whole quarantine thing. So have a good night, everyone.